In Pok Oi Hospital, ethnic minority group occupies 20% of the patient population. Among them, a lot of the Pakistani and Nepalese housewives cannot speak English or Cantonese. Their knowledge towards local medical system comes from either the word of mouth from family and friends, or from the activities organized by NGOs and the hospital. So what are the problems? Every time EM patients come to the hospital, they need to be accompanied by friends, families, and even their small children as their interpreters. However, adult family members always dominate the conversation with healthcare professionals without actually asking for feedback from the patients. Even worse, due to their lack of medical knowledge, small children can hardly translate difficult medical terms and medical instructions for their parents. Some patients will choose not going to the hospital if there is no accompany available. This could seriously jeopardize the health of patient. How can we help them to overcome this communication barrier? Different levels of communication are required during the patient journey, from quantitative to qualitative, from pronunciation of their names to duration and days, to express the sickness and evaluation of pain. Stress and anxiety accumulate when the patients cannot express themselves and cannot comprehend the diagnosis about their own health. In current patient journey, nearly 2/3 of the time spent in hospital is pure waiting. How can patients make better use of this wasted time? What if patients could express their concerns and acquire useful information while waiting? What if both patients and caregivers could easily express themselves and understand each other? Embrace is an innovative system that will enhance the medical experience of ethnic minority. It empowers them with effective tools communicating their own health condition without relying on interpreters. Embrace consists of networked portable devices used by the patient and the doctors. Q&A posters have keywords for effective communication such as pain scale, allergy, suggest lab test, and numeric answers. Let's meet Seta, a Pakistani lady, goes to A&E department for the first time. After registration, Seta gets her own portable Embrace device showing her patient ticket number. The device invites her to input her symptoms before the triage course. She expresses her fever and identifies related symptoms on the list. After a while, the device calls her to go to triage station for preliminary checkup. After triage, while waiting in the lobby, she checks approximately how long she has to wait for doctor consultation. By then, the device acquires for her health and allergy history. As the questions are in her native language, she feels confident to express herself. She also highlights questions she wants to ask the doctor. Being new to the hospital, Seta clicks into the information section and learns about the process of the patient journey and various medical services provided by the hospital in promotion videos. She feels secure and is more prepared for the coming steps. In the waiting lobby, there are posters with quotes of patient concerns in Urdu. She feels that the hospital has great compassion for her needs and difficulties. At this time, the device calls her to see the doctor. In consultation room, her symptoms and health history are already shown on doctor's device. The doctor reads her basic inputs. Based on Seta's condition, related questions have been shortlisted. Speech button is available for asking those questions in Urdu when needed. For in-depth diagnosis, voice translation in the device comes in handy. When the doctor asks about her headache, Seta points to the pain scale on the Q&A poster to express the severity and tell when it began. The doctor then indicates suggest lab tests with Q&A poster. In the process, the doctor used confirm buttons to confirm all useful information to the CMS for the patient record. Then, Seta moves to the next station, where the nurse prints out lab test instructions in Urdu and explains to her clearly. Similar functions help Seta go through the rest of her journey, from lab test to pharmacy. With Embrace, Seta has better control over her patient journey. She could express her health condition effectively, learn about important medical instructions, and she is emotionally more engaged.